Welcome back. Up until now, Michael J. Fox has been the public face of Parkinson's disease. The actor, father, and husband still fighting it after 23 years, going public 7 years after he was diagnosed. And now we're finding out that beloved actor, comedian Robin Williams received that same diagnosis not too long ago and was in the early stages of Parkinson's before committing suicide. Robin Williams, big supporter of the Michael J. Fox Foundation, which is dedicated to finding a cure for Parkinson's. And in a tweet, Michael J. Fox expressed shock over the diagnosis, writing, "Stunned to learn Robin had Parkinson's. Pretty sure his support for our foundation predated his diagnosis. A true friend. I wish him peace." And Robin Williams' wife had indicated that Robin Williams himself was not ready to share this diagnosis. Join me to talk further about this, Dr. David Charles, professor, vice chairman of neurology at Vanderbilt University Medical Center. Doctor, all right, so a diagnosis like this would do what to someone who's already battling severe depression?
Yeah, thank you, Mike. Thanks for asking me to join you. So Parkinson's disease, obviously, 1 million Americans with Parkinson's disease, 60,000 new cases per year, and it's a relentlessly progressive, disabling condition. So that news for anyone, as you might imagine, could be terrible news and cause great concern in any of us. In Parkinson's disease, however, depression and Parkinson's are linked. People with Parkinson's disease have depression at a rate far higher than the general population. And sometimes depression actually precedes the diagnosis of Parkinson's disease.
Okay, so what would have been, so Robin Williams in the early stages gets the diagnosis, what kind of treatment would he need? And then take into account he's battling depression in the meantime.
Well, when a person's diagnosed with Parkinson's disease, the treatment is really tailored to the symptoms that they're experiencing. The typical person has maybe tremor in one hand or the other. They could have some stiffness in the muscles, slowness of movement, difficulty walking. And so their physician will tailor their medications to treat those symptoms.
Okay. And symptoms can look different, right? I mean, we're certainly used to, we see someone with the tremors, but it's not always that, right?
Exactly. So Parkinson's disease, like depression, is a very complex illness. Patients, some of them may experience lots of tremor. There may be the next patient that doesn't have much tremor at all. The rate of progression can be quite different from patient to patient. Some seem to progress much more rapidly than others. Most people experience a slow progression over time of their tremor, stiffness, slowness of movement, that sort of thing. And the medicines we have are very good, like the medicines that we have for depression. But depression and Parkinson's disease are clearly linked. The rate of depression far higher in people with Parkinson's disease than the general population. And so the diagnosis of depression is very serious, just as serious as the diagnosis of Parkinson's. So you can imagine how those two occurring at the same time would be a tremendous struggle for someone.
Right. And so what do you tell them?
Well, certainly you tell them the truth. The truth about Parkinson's is that we have great treatments, and the truth about depression is that we have great treatments, but it's imperative that people seek care for both of these conditions, and when they occur together, to be seeking their physician, seeking care, calling on the support of friends and family, and then following the instructions from their physicians in treating the conditions. Often, you'll find people that are reluctant to talk about depression, and that's terrifically unfortunate because most of the suicides that occur are in people who are suffering from depression, and so the diagnosis is just so serious. But the good news is we have great treatments.
Yeah. Hey, Doctor, thanks again. Here's some more reaction on this. Here's a tweet from Josh. Oh man, this story just gets sadder and sadder. Poor man. And here's a tweet from Katie Couric. Was crushed to hear Robin Williams was battling Parkinson's disease. My dad had Parkinson's disease for over 10 years. So important for us to continue supporting research. That again from Katie Couric. Doctor, thank you again.